Hello, Dr. G here. I want to give a message to the men out there about the coming push to get you on more drugs. Did you know that 1 in 5 men over the age of 50 will sustain a fracture that is related to osteoporosis? When you add up the total population of men out there, that turns out to be a heck of a lot of men are affected by this. Now, not as many as women, because women actually have a 1 in 3 chance of having a fracture related to osteoporosis. But it's still a major issue in men. Now, a particularly bad statistic for men is that within 12 months of a hip fracture, 37% of those men will be dead. So osteoporosis is a serious disease. What does mainstream medicine want you to do about this problem? Well, to get an idea, let's take a look at a recent report published actually in October 2014 by the International Osteoporosis Foundation. Sounds like a pretty unbiased organization there. Now, this report states that men were 50% less likely to be screened and treated for osteoporosis than women. Now, what is the treatment that mainstream medicine advises for osteoporosis? And of course, it's drugs. One of the leading drug classes that's used are the bisphosphonates, and these have some devastating side effects like osteonecrosis of the jaw that's almost impossible to treat, spontaneous femur fractures, hate when that happens, and then there's also the sometimes fatal esophagitis. Well, the lead author of this report and the president of the International Osteoporosis Foundation apparently don't want men left out of this potential for side effects. They call for government and patients to demand that this gender gap be closed immediately. And that means more screening and more treatment. In other words, men must demand equal rights to the toxic drugs. Now, how do I know they want you to take drugs? Well, in the disclosure of the report, it shows that these two doctors have financial connections with a long list of drug companies like Amgen, Merck, Novartis, Eli Lilly, GlaxoSmithKline, Agnovus, D3A, Medimaps, Unigene, Taylor Wessing, Pfizer, Sanofi, Asahi, or something like that, Medtronic, Servier, and Warner Chilcott. Now, I found a much more effective and safer strategy, and that's to identify the cause of low bone density. Whoa, what a novel idea. And let's address those causes. I do this by evaluating hormone status and other labs, lifestyle, diet, and markers of inflammation. And then we address these issues on an individual basis. The outcomes, I'll tell you, are far better than the use of drugs in my experience of 30 years of practicing medicine. The big added benefit is that by addressing the cause, we'll have a major beneficial impact on other major modern diseases like type 2 diabetes, mental disorders, osteoarthritis, autoimmune disorders, heart disease, cancer, and neurodegenerative diseases. And when you rely on a drug to treat the disease, you have the potential for major side effects, and it will still leave you vulnerable to all those other diseases that will potentially occur because you've ignored the cause of modern disease. Now, if you like this kind of health information, please subscribe to this channel. This is Dr. G. Thanks so much for watching.